Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and today our patient is Dustin Gillum. Dustin is the CrossFit coach and owner at CrossFit Pistol Creek right here in Maryville, Tennessee. Welcome, Dustin.
Hey, hi guys.
All right, so what you got going on for us today?
Just a little bit of tight hip action and tight shoulders.
Okay, sure. And have you had chiropractic care in the past?
In the past, yes. So I had some nerve injury or nerve damage, I guess, if you will, some nerve pain in the low back, and that was resonating down my glute, down the back of my hamstring, and into the top of my foot. Went and sought a little bit of help, and after about 6 months of 3 days a week therapy, got it ironed out with some TENS unit therapy and some, manual adjustments, and subsided and got me back to normal, if you will.
So it's 3 times a week for 6 months?
Ish, yeah.
So that's a pretty big commitment.
Right.
Okay, and what did they say was wrong with your lower back?
Subluxation.
Subluxation, okay. So subluxation is one of those terms that is a kind of a hot button in the chiropractic profession. Historically, chiropractors, they were trying to figure out, well, it seemed like there's misalignments, and it seemed like improving alignments improved people's health. Mm-hmm. And people were getting thrown in jail for practicing medicine without a license.
Sure.
So then legally, the approach of chiropractors that were getting thrown in jail was, well, we're not practicing medicine, we're detecting and eliminating subluxations, which typically the definition of a subluxation is a misalignment with nerve interference to the tissues. As we've grown as a profession, some chiropractors say, I treat subluxations, some don't really bring the word up. I'm one of those that doesn't really bring that word up much at all. We saw, looking at your x-ray, that you had some alignment issues. We didn't have the curvature, we didn't have ideal alignment, so I'll just call those misalignments. Okay. Do they involve nerve interference or nerve dysfunction? 100%, and we're going to see that during your treatment. You'll kind of understand how the nerves matter when it comes to your alignment. Whether you're subluxation based or non-subluxation based, that they're still getting people better. Okay. And I think that's what matters in the long run. But yeah, subluxation, that's one of those big words. When you're CrossFitting, tell us a little bit about the life of a CrossFit coach or just a CrossFit athlete. Like, how many times per week are you working out?
7.
7 times, yeah. Okay. And what are you generally trying to do with your CrossFit workouts, other than, of course, be healthy, be in shape?
So, overall, CrossFit's goal is to just make your daily life easier, whether that be playing with your grandkids, your kids, yard work. So what we do supplements that, but, we train all different modalities, whether it be metabolic conditioning, Olympic weightlifting, or gymnastics. So we kind of touch on all the modalities and then kind of meld them together just to make you an overall fitter person. That way you're not a specialist in any one thing, you're just pretty good at all things.
Sure. Now what's your response to, there's plenty of people that think CrossFit's crazy. There's mm-hmm. plenty of people that think you're just waiting to get injured mm-hmm. or something along those lines.
Well, that comes with anything. You could go take a yoga class and slip a disc or get injured. So it's all in how careful and how closely your coach is instructing you and how well your coach has been trained, and making sure that you aren't at risk of injury and putting yourself in a position to where your body's not ready to do those movements yet. So that's on the coach, but you can get injured in anything, so I wouldn't
walk across the street and
Absolutely.
Get hit by a bus.
Absolutely.
Sure. Okay, well, let's get to it. We looked at Dustin's x-rays, and what we could see was a little bit of the beginnings of degeneration and arthritis in the lower part of his neck, as well as in the lower back a little bit. On his movement examination, the big things was neck rotational mobility was pretty darn limited, and his complaints as a CrossFitter are that his upper body mobility isn't quite what it should be, and it impacts him when he's, say, holding a barbell in front of him and doing overhead pressing, they call it. So we're going to see what we can do to help out with that. Certainly, whenever you have limitations in the neck, that opens the door to added stress and strain on the upper body and the shoulders. So we're going to take a look at that. He also says that his ankles are pretty limited, so we'll see what we can do there. So let's get to it. All right. So I'll just start with feeling around for the tension in your neck, seeing what's moving well, what's not. I mentioned that the lower part of your neck had some degeneration and arthritis, and when it comes to rotational flexibility, a good majority of the rotational flexibility in your neck actually comes from about the C2 segment. So I'm going to see that that upper neck is getting as flexible as possible. We definitely have some restriction there. So that we can increase your flexibility of your upper neck, take away some of that stress and strain of the lower neck. So how long have you had, has CrossFit Pistol Creek been open?
Since 2013.
8 years.
Yeah.
That's pretty good. Have there been other CrossFits in the area?
There have been a couple, but
Because that's really, I think that's the only
we're
one in the Merville area, right?
Mm-hmm.
All right. So when I put a little bit of motion into this side of your neck, there's some nice movement. On this side, it's almost like it goes into instant tension in your neck, and I can't quite get the same range of motion. Do you feel that difference?
I do.
So I'm going to do an adjustment, and we're going to see if we can't help out with that. And here's your C2 right there where all the rotational flexibility is. So let that go here a little bit. Very good. Got some nice motion in there, and already that end play is a little bit more flexible. Can you tell that difference?
Yes.
All right, good. We'll get over here to the other side as well. All right, and we'll get a little bit of motion right there too. Drop your head. Very good. All right, so we'll go right into rotational flexibility now. And that right side still, that's doing pretty well. Left side is still a little bit limited, so I'm going to see if I can't release any of the muscles. That might be limiting that. A little bit better. Okay. So what I'm going to do is some muscle tests, and that's going to tell me what's working and what's not working about kind of your upper body and what I need to treat.
Okay.
How do you feel after that first one?
Immediately better.
Cool. All right, make a fist. I'm going to do a muscle test where I push your elbow down into the table, so resist that. Again. See, that's just a little bit weaker than I expected. Any irritation? Okay. I'm going to do a little bit of an adjustment to the lower neck where some of those arthritic changes are. Drop your head there a little bit. Good. Make a fist, pushing down. And that's stronger.
Okay.
Can you tell?
I can.
Okay, good. All right, we'll put your thumb and your pinky together like so. I'm going to pull them apart. Resist that. And again. Yeah, that's pretty good. We'll do a muscle test. I'll bring your elbow into your rib cage.
Okay.
Kind of externally rotate. I'm going to pull your elbow that way.
Okay.
Okay, so just resist that. Pretty strong. Make a fist. I'm going to push down. Don't let me. And there's some bounce there. So that's the serratus anterior. It kind of protracts the shoulder blade there. So I'm going to see if there's any restriction between your rib cage and your shoulder blade that might be limiting it.
Okay.
So I'm going to do an adjustment underneath your shoulder blade. So what I want you to do is put your right palm right to your ear. I'm going to stick my thumb in your armpit, wrap my hand around your shoulder blade.
Okay.
All right. Take a deep breath for me. Breathe out. Very good. Okay. Make a fist. I'm pushing down. Resist. That's definitely stronger, yeah?
Much stronger.
Good. So that's going to stabilize and support your shoulder blade a little bit more now. Couple more tests here. And this is the elbow, isn't it?
It is.
Okay. I'm going to do a muscle test where I push that way. Resist. Again. That's so funny. Your pecs are very big, but they just tested weak.
Right.
So they're not exactly firing the way they need to. And what I'll do, let's see if I can't help with that. So I'm going to grab where your clavicle and your sternum meet, and we'll do a little adjustment right there. I feel for where the joint is restricted and not really moving the way I want it to. I feel like there's some nice balance there. Right there feels locked to me. So let the elbow drop down, and I'll give it a little adjustment. Hold it right there, pushing out that way. Definitely stronger now.
That's insane.
Now, when you had your elbow surgery, they cleaned out all the arthritis. They released your bicep, they released your tricep. You didn't come out of that being able to fully lock out your elbow?
Not completely. He said I was only going to gain about 30% of the range of motion that I'd lost. So I got back about 20-ish% if I were to put a number on it, because of my level of activity. It just exacerbated the arthritis coming back.
Okay. So what's more limited, the flexion or the extension?
I would say it's about 50-50 both ways. I mean, I don't obviously have a full range of motion, extension or flexion. I would say the extension really is what affects my working out more than the flexion.
So we've got about 35. So if 180 was what you wanted to be, probably can't get it to 180 today, but we might be able to get some.
Sure.
So let's see what we can do. So the first thing I'll do is I'll just get in here and I'll do some myofascial release of the soft tissues. So I'm in here with the biceps, and really I'm going deep to the biceps at the brachialis muscle. Are we feeling pain?
Just pressure from you.
Okay. And when was the surgery?
November of 2019. Yeah.
How extensive was your rehab after?
It was about 4 months of passive, like you're doing now, 3 days a week.
Try to straighten your elbow. Getting some nice tenderness in there, huh?
And I try to cheat it by picking my shoulder up.
Oh, yeah. Okay. Again, straighten it. So you could see his bicep tendon is right here. I'm going just underneath to his bicep tendon where the capsule is, and I'm putting a strong tension on it. Straighten. If we could get a couple degrees of motion and relaxing out of that capsule, that would go a long way to help him out.
Already feels like it's got more.
Yeah? All right, good. Then we'll do a couple of, we'll do some chiropractic stuff. So straighten your hand. I'm going to pull towards me.
Okay.
Resist that motion. Ready? Definitely not so strong with the biceps. And then keep your hand straight. I'm going to push towards you. Again, a little bit weak with the triceps. Wrist flexed. I'm going to push towards you. Resist. Okay. Extended. I'm going to push towards you. That's pretty strong. Not too bad there. So I'm going to do a little bit of a elbow adjustment. This right here is called the speeder board.
Okay.
Purpose of this is for me to be able to do a sudden thrust into your joint. Oh, not with that tension. Without much discomfort on your part. So what we'll do here, okay. So we'll go right into the speeder board here, and I'm going to do a manipulation towards extension, like so. We'll do one more here. Nope. Good. So that'll make a difference for you.
Sure.
For sure.
I mean, that feels way more like I've got way more range of motion.
Yeah?
On the extension especially.
Perfect. Good. Okay. Make a fist. I'm going to push your elbow down. Resist that. And that one's week 2. Okay. We're going to do an AC joint adjustment. So a lot of what we're doing is muscle testing to see, are your stabilizing forces of your shoulder and shoulder girdle, are they doing their job?
Okay.
And they're not, right? Pushing down. If your internal stabilizing forces aren't doing their job, then your big muscles have to take over. The traps, the lats, the ones that get super, super tight and limit your overall motion. Thumb and pinky together, pulling apart. Great. Elbow in at your rib cage, pulling out towards me, don't let me. And that one's week 2. So we'll do that adjustment. All right, put your left palm on your ear. I'm going to stick my thumb in your armpit, wrap my hand around your shoulder blade. That's good. Breathe out. Ooh, that was like a punch to the ribs, huh?
Felt great.
All right. Elbow in at your rib cage, pulling out towards me. A little bit stronger. Let's check this one. Make a fist, pushing down towards you. No, that's plenty strong. Good. I'm going to push out that way. Don't let me. Still weak with the pecs. So, drop the elbow down. And we'll get where the sternum and the clavicle meet here. Nice. Hold it right there. Pushing out that way. Still a little weak. So I'll go a little bit lower where the ribs and the sternum meet. We tend to right there?
Yeah, a little.
Just a little.
I did bench press earlier.
Today?
Yeah.
Hold it right there. Pushing out that way. I still don't like that. How hard did you go with bench press? Like, did you really fatigue yourself out pretty good?
Quite a bit.
I'm going to release his pec major muscle here. And then I'll get into pec minor here too. Can you feel the lengthening of those tissues in there?
I can.
Good. All right. Pushing out that way. Don't let me. There you go. Much better.
Feels better.
Take a deep breath. Breathe out. You've probably been doing thoracic spine work for 8 years, right?
I do a lot of like T-spine rotations.
Yeah. All right, muscle test. I'm going to straighten your knee.
Okay.
Don't let me do that. Good. Other side. Straightening your knee. Don't let me. Very good. Raise your knee up towards the ceiling. I'm going to push your knee into the table. Very strong. Knee up into the table. That one's a little weaker, isn't it?
Yeah.
Drop this knee down. All right, so the glute wasn't firing great on the left side. So I'm going to grab your sacrum. Breathe on out. Good. And go face down. Bring your knee up. Hold it right there, pushing down. There you go. A little stronger, yeah?
Much stronger.
All right, so let's start. Why don't you bend this knee? Yeah, it's interesting. When we did that movement assessment on your ankle dorsiflexion, it was good. But when I actually put the passive range of motion in there, that ankle's, you have less than 0 degrees of dorsiflexion. So it's really not great when you take tibial rotation out of it.
Gotcha.
So you were spot on in noticing that your ankles are stiff. So that's the full dorsiflexion he's got when I put it, which is probably right at about actually 0 degrees. All right, I'm going to do an arch adjustment here. Good. Okay. I'm going to release. See if I can't feel to see what is the limiting tissue in your ankle dorsiflexion. It feels pretty deep in there, like it is the joint itself. I'll give you a little yank here. Good. Now I'll do a couple of quick muscle tests. Bring your foot up and out. Hold it there. I'm going to push down like so. Resist that. Very strong. Point and out. Hold it right there. Push from right here. Resist me. Good. Up and in. Hold it right there. Push from right there. A little bit weak there. Point and in. I'm going to push from right here. That's plenty strong. So a little bit with that tibialis anterior muscle test was weak. So I'm going to see if we can't get that muscle to fire. Good. Up and in. Hold it right there. Push from right there. And there we go. Great. Switch legs. Any particular ankle injuries?
Mm-mm.
All right. Foot up and in. Hold it right there. Push from right here. Perfect. Point in and in. Push from right there. That's weak. Up and out. Hold it right there. Pushing down. Good. Point in and out. Hold it right there. Push from right here. Very good. So that right in here, a little weak. What I want you to do is bend your knee. I'm going to bring back the speeder board and do a little bit of a heel adjustment. Good. Up and out. Hold it right there. Push from right here. I like it. Better. Okay. Give me one rep. where you just look up as far as you can. Good. Now, we're going to do another. Centered. All right, I want you to make a fist here. And keep that hand behind your head. I want you to push the fist into the table, okay? And as you push that, you kind of lift up and look your eyes up and try to find the spot on the ceiling and down. So the first exercise we did the thoracic reach back, or what I call thoracic reach back. Talk a little bit about what that was like for you.
It was humbling. It was hard, especially the lack of range of motion that I thought that I had. Then when you put me in that position, obviously it wasn't there. Then when you had me doing the kettlebell and the rowing, learning to breathe through the movement and actually exhaling on the way through the extension of the movement, eye-opening.
It's a drastically important skill. How can you keep engagement and stability while breathing in a relaxed manner? It's not always easy to do, but in this setting, it's extremely important when we're really changing people's patterns of their movements.
Right.
So you did a really good job with that. Yeah. Once you have that stability that you're noticing that you don't have, the flexibility will really open up. Come on back. Protract it, protract it. So right there. And back. Lastly, we did the arm bar body roll. Talk a little bit about what that was like.
That was tough. Having to stabilize and protract my shoulder, but learning to lead with the leg instead of trying to let the bigger musculature take over was difficult.
It's an interesting point you bring up because our hips should be the strongest, most mobile. They should be leading the movement for the majority of our body. And somebody like you clearly has very large muscles. You've had to compensate to where your upper body is really doing too much.
Right.
And the hips probably not enough.
Okay.
So in an exercise like that, you're right. You had to understand, let the hips do their thing while the shoulder stays behind and stays stable and then gets some motion later. So that's a great one for you to work on.
That, like I told you, is humbling and some work that I need to focus on.
That's our treatment. Dustin, how'd that go for you today?
Very well. Nice. I feel a lot better.
Yeah?
Yeah.
How so?
Just more range of motion through the shoulders, the thoracic spine, the hips, shoulders. And when you did the pec release and the AC joint release, I can feel an immediate change.
Awesome. Thank you so much for being a great sport in front of the camera here for your treatment.
Yep.
And this is Dr. Scott Hoar. Thanks for tuning in to Treatment Tuesday. Look for our next video next week. Also hit the like button, the subscribe button, and leave a comment below. Don't forget to look at Dustin at CrossFit Pistol Creek. His website is
CrossFitPistolCreek.com.
There you go. Thanks so much. Have a great day.
Thanks.